Hello, it's Jenna Dalton, and I am here with Dr. Carrie Pagliano, who has been a leader in women's health for nearly 20 years. She's a double board certified clinical specialist in orthopedics and women's health, and she also holds manual therapy certification. She's an active member and on the board of directors as past president of the Academy of Pelvic Health Physical Therapy. She's a national media spokesperson for the American Physical Therapy Association and a vocal advocate for women and mothers in leadership in the physical therapy profession, which is amazing. She founded her own practice, Carrie Pagliano Physical Therapy, in Arlington, Virginia, where she lives with her husband and 2 children. Thank you so much for being here, Carrie.
Thanks for having me on.
Yay. So let's talk about running postpartum. First, I would love to just dive into your personal experience. You have 2 kids. You had to work to get back into running postpartum. So can you speak a little bit about your own personal experience?
Absolutely. So I've run since middle school. It's something that's always been kind of a part of who I am as a person. And obviously once you have kids, a lot of things change, not only physically, but with time and so on. And I think when I talk about kind of returning to activity postpartum, as far as my story goes, I always kind of put the caveat that I went into this thinking that I was the expert because I'm supposed to know all the things, right? And I share my story because I had to learn a lot and I thought I was supposed to know better. So for moms to feel super guilty and gosh, I should know better. I should know how to fix this stuff. Like, this is my job. And it made me go down a rabbit hole to learn how to kind of deal with this stuff. And my kids are, how old are they? They're 9 and 6. It's funny how you're like, wait, how old are they?
Yeah, I see it all the time too.
I don't know. And I mean, kind of from the get-go with my oldest, I distinctly remember I was going to run through my pregnancy and basically run into the delivery room and all that good stuff. My body had different ideas. And I distinctly remember at 19 weeks trying to go out for a run. And I, went to the bathroom like 17 times before I left. And literally every 10 feet feeling like I had to go to the bathroom again. And about, I don't know, a half mile in, I just sat down by the Potomac River in a parking lot and I called my husband. I'm like, I can't do this anymore. It just literally felt like what little was left in my bladder was going to come out with every step. And so I think that was, I say that that's like the first lesson of parenting is that you don't have control over a lot of this stuff. And that was kind of my first glimpse into not necessarily having to be able to choose my path in what I was dealt. And so that's when I get to throw my parents under the bus and the genetics that I was dealt in that respect. So my mom and I need to have a conversation. But I think that's the other thing too, is, and especially social media now, like we're all supposed to, by 6 weeks, be running marathons. But if the genetics that you were dealt wasn't necessarily meant to handle that stuff and how you delivered, like these are kind of the things that we cannot necessarily control because that delivery is in the past. We have to take these pieces into consideration. And same thing with my story. My oldest, I love him dearly. How he came into the world was not the way I would have chosen it. It was basically, a 3-day induction that ended up in a C-section. And that wasn't part of the plan. Figuring out how to run after that, things were pretty okay. And then my 6-year-old, we had a miscarriage in between the two, which kind of complicated things. And then by the time she came out, all of a sudden I'm dealing with diastasis recti and a little bit of pelvic organ prolapse and a little bit of stress incontinence. And again, like I'm supposed to know better. I'm supposed to be the vision of everything right. And again, I think what we see on social media, a lot of the stuff that's out there is, look at me, I look fabulous. I'm doing everything right and I don't have any symptoms, and you can do that too. And I don't think that's necessarily realistic. Not because, could I work harder and try more? Yeah, totally. I will put that one out there for sure. But at the same time, there's some things that I can't change. And there's also some things that, this is in the context of raising a bunch of kids and having a small business, and like, I can't do all the things. And so I've shared my story, to just be a little bit more realistic and put, I think, what women hopefully need to hear, that it's not their fault. They shouldn't be feeling guilty about all these things, but at the same time, in a positive way in which we're not scaring the bejesus out of people. I just did a post yesterday because somebody had talked to me about writing something about how having a weak pelvic floor is dangerous. I'm like, I don't know if I put that word on it. But again, if that's what we're feeding, other things that I've seen from voices out there, that returning to run postpartum with a diastasis recti is not something you should be doing. I'm like, wait, what? And for those of us that running is kind of part of who we are, and granted, there's people that it's very much more their identity than mine, like somebody telling you, no, you can't do this, like, I'm going to stop listening. And so I think having a voice of somebody saying, I know this is part of you, I'm not going to take it away, but do you mind backing up a couple steps and let me show you what needs to be done? And that's where I think a lot of these screening tools come into play finally, that we've got some things to say, all right, well, you've got some deficits here. Maybe you can run a little bit for your sanity, but maybe we can also focus on these other things so that we can get to those longer distances and you can do these things that you want to do. But yeah, it's a really complicated road, and to be in it, it's not only as a kind of a patient, so to speak, or somebody having to work through that mentally and physically, but then also trying to guide somebody through. Like, it's super interesting from a professional perspective, but being in it as a person having those symptoms is enormously frustrating.
Yeah. Oh my goodness. So many good things. And I think that, like, really touching on, there's so much comparison in postpartum, whether it's comparing yourself to your pre-baby self, comparing yourself to other mothers or other women.
Yeah.
Like, there's so much comparison. And I think that that's where the frustration can come in, right? Because you think, well,
Totally.
I used to be able to do it, or she can do it. Why can't I? But let's touch a little bit in terms of, you talked a little bit about some key considerations, some key steps that we should be focusing on before returning to running, especially long distances.
Yep.
So can you touch a little bit more on what that might look like?
So I'm totally going to push the credit where it's due. There's a group of physios that just put out, I think the original UK guidelines came out about a year ago. There's an infographic that just came out in April. And some of the guidelines, and again, trying to piece this stuff together, there's not a ton of research dollars in this. So they're trying to pull together data on return to run from regular injury with retrospective studies looking at some postpartum issues, but also taking into the context all that we know about, pelvic health and diastasis, which isn't much. And then we also have to throw in hormones, other risk factors like sleep and nutrition, breastfeeding. How do you kind of combine all this hodgepodge together, and what do you come out with? And so that's what this one particular group did. And the basic guidelines are, in general, and of course there's always variants. In general, 12 weeks postpartum is really kind of that sweet spot in which you've settled in. You should have a little bit more strength under your belt. You've done some walking. You have a good sense of where the starting point is. And so there's other screening tools that I have used. And I'm so tired of not having postpartum research. So I kind of pull from sports medicine and orthopedics, and we kind of bastardize it for what we need and then see what happens. So I'm super comfortable in that, because, if you don't have a tool, well, great, we're going to make something up. Yeah. And so there's been some great stuff. Blaze Williams, who now works with Nike, he had put out a screen a couple of years ago. That's one that I play with. It's got 5 components to it. And again, these are just basic return to run after injury. They weren't meant to like, it wasn't developed with the purpose of looking at postpartum, but when you look at the components, they make sense. So what we know is when we're pregnant, we have a wider base of support. Our abs get weak, our hips get weak, our balance is off. And postpartum, we're probably gonna have some issues with impact. And so this particular screen that Blaze did, I think it's 1 minute wall sit, 1 minute step ups. I think there's a single leg squat, both sides. There's a hopping component, which again, if you have any leakage or any sort of prolapse symptoms, like we're going to screen that out in about the first 5 seconds.
Yeah.
And then the last one is plank. And plank is always like this controversial one because there's so many programs out there that say plank is bad, sit-ups are bad. And again, there's just no data to support it. But we need ab strength to run, and we need hip strength, and we need balance. And so this gives us a starting point. And I think ultimately that's what moms are looking for is, this whole 6 week and okay, you're free to go. Like, what does that mean? We want to have something to focus on. We want to have something to work towards. And so that screen I had kind of played with for a couple of years. And then I've recently been in touch with a PT, Chris Johnson, who's out of Seattle. He goes a little bit more in depth. And again, these are just regular return to run, not specific to postpartum, but I think his work is more reflective of what's come out in the UK guidelines, and they know similar people. That one's looking at other things like, can you hop on one leg? Can you do a side plank? So that looks at more kind of forced translation and obliques. Can you stand on one leg? What does your balance look like? Just more of those components that you do need to be able to return to run. And I get questions all the time. Well, what if I started running before I knew about the criteria and I go back and some things are missing? I'm like, I'm not going to take it away. But if a lot of pieces are missing, you're increasing your risk of having some issues. Or if you're symptomatic and you're running, the screen may give you some ideas on where you might want to focus that might be able to help address some of these things. So if you have symptoms in the first 5 seconds of hopping, okay, great. We need to look at impact. We need to look at breath. We need to look at a bunch of things there. And maybe a way to kind of scale up with that too. So the screens have been great to give us a starting point. By no means are they, all encompassing, but it's better than what we had before, which was nothing.
Yeah. Yeah. Well, and I think that it also speaks to the runner or the athlete mindset, right? Where it's like you're working towards something. If I can do this for a minute, or if I can do this with good form or whatever, then that's giving me some feedback, and I can see my strength improving. I can see my results improving week by week. And that gives you hope. That gives you feeling like, okay, I'm getting somewhere, instead of just constantly trying to go out for a run and then not, like, always getting the symptoms.
And it's no different. Yeah,
exactly. So here's like kind of along the same lines of like the runner mindset, the athlete mindset that I actually learned from Brianna Battles in her pregnancy and postpartum athleticism course. The whole like athlete mindset, that it's like you kind of push through pain and you don't pay attention to your body and you just go kind of thing. A lot of women who were runners pre-baby might be going into this and thinking, well, I know how to run. I know great form when I'm running. I know all these great techniques, all these great strategies, everything like that. Can I just dive back into running? Why do I have to wait 12 weeks?
Yeah.
What do you have to say about that?
I teach at a couple local universities, and my students absolutely hate the fact that anytime I get a question like that, I'm like, the answer is it depends.
Yeah.
Which no one likes.
No.
Same thing again with MediaCore. It's really fun because ultimately the journalist would like the simplest answer, and I'm like, but no, it's not that simple. I also work with a lot of I don't know what they're called anymore, CrossFit athletes, because obviously there's a lot going on with that right now. A lot of women who do functional fitness and Olympic weightlifting. And there's a lot of impact there and a lot of things going on. And it's a very similar situation, I think, whatever sport that you're in. And what it comes down to is, again, what we come out with postpartum. There's a couple of things that we have to check out. Like, what did you have walking into this? What did things look like through pregnancy? What did delivery look like? And then what are we working with now? I mean, I've worked with athletes that we checked the boxes on no symptoms. Everything looked good. They could contract everything and relax everything, and that all looked fine. They were very well aware of red and yellow flags. They were very aware of a good progression to build a baseline and scale up instead of picking up where they left off. And in those cases, I feel super comfortable saying, go ahead and get started. If any of these things come up, those are indicators that we may need to play and back up a step. I think the problem in that is we all think we're further ahead than we actually are. Well, and honestly, that's, I think, a hard thing too, because there's a lot of programs out there where, and some of them are great and some of them maybe not so much, is people are giving advice because they're fast runners.
Yes.
And they're not having problems.
Yeah.
And I'm like, yes, but I am never going to be Olympic grade runner. I'm just not. Wasn't built that way, never will be. And so I can't treat my return to postpartum the same way as like Alyssa Montano. Like I can't.
Yeah.
I will never be her. And
Yeah.
that's fine. I've accepted that and moved on. And I think that's hard when we're like, but they can do it, why can't I?
Mm-hmm.
And so with a lot of my clients, we basically, it's kind of like a recipe. Like you have your own ingredients in your own amounts. You like your mom's secret sauce is like a little bit of this and a little bit of that. Yours is probably a little bit different. And so knowing what your ingredients are in what amounts helps you decide whether or not you can go fast or slow. Like if you've got awesome genetics and you had a great delivery and everything that you can't change is in your favor, awesome. Then you just need to build up on the other stuff. But there's certain things like pelvic organ prolapse, they're finding that there's some genetic predispositions. I think there's a lot more genomic studies looking at different types of urinary incontinence to see if there's any factors that we might be able to look and see if we can change, or things that maybe can't change in that. And I think that's where the oversimplification of a lot of these things comes in is, if you have symptoms, it must be your pelvic floor. And it's just, I wish it were that simple.
Yeah.
We're just way too complex for that. And we've got backup systems, which is really good.
Yeah.
But like, I've had patients with like, they have no sense of a cognitive pelvic floor contraction or relaxation or anything like that. Totally fine. No problems. And then other people, because, when they contract, they just don't have good stiffness purely from a collagen perspective. Like that's nothing, we can try and bulk up as much as we can, but, ligament laxity might be working against us or something like that. So the short answer is it depends, because we don't all walk in A with the same ingredients, B with the same amount. And so we can't treat it as the same. But unless you understand that piece, you're going to be forever disappointed why you can't be like an Olympian. Because some of us were meant to be and some of us were not.
Yes. Yeah. And I think it's important too, you've touched on this before, bringing in the whole hormonal aspect to it too, and how there's changes throughout the month. We're women, our hormonal profile is fluctuating constantly. And so
Yep.
understanding that even though you could go for a run and it felt great last week, maybe things have shifted this week. And that doesn't mean that you did something wrong, or that you're doing something wrong during this run. It might just mean that hormonal shifts are happening and that's creating a change in your body, or you didn't get enough sleep last night, or you had some alcohol, or all these different components. And understanding that there are outside influences beyond strength and genetics that can also contribute.
Totally. Right? With that one, I mean, I started doing the CrossFit that shall be unnamed about 3.5 years ago. I don't know what else to call it right now. This is fresh off the whole controversy, by the way. We're within 48 hours of it.
Yeah.
No, I mean, I started to get some strengthening because I had hip surgery 14 years ago after a Marine Corps marathon. And I was having some issues, and, I would go through and try it, and I'm like, no, it's not that, it's not that, it's not that. And then finally I sat down with a calendar and started tracking and realized that I had some very predictable shifts in when I would have a leak with a run or a leak with a jump rope or something like that. And for me, it resulted in a conversation about a birth control change and those sorts of things. And is there any data to support that? It's getting better, but again, there's so many variables. Is there a paper that looks at just my genetic profile and all these other things? No, absolutely not. But what I encourage people to do is if you can't figure out what's going on, or if you have some, if you go to get help and all they're giving you is pelvic floor muscle training and it's not helping, we need to look further. That doesn't mean it doesn't mean you're a lost cause at all. It means, hey, the basics aren't going to cut it. It's more complex than this. Maybe start tracking your symptoms a little bit related to what you eat, related to your sleep, and keep it simple because we obsess over this stuff.
Yeah.
Like literally just make it red, green. And that's what I did. I literally had a chart and I'm like, okay, today's workout was green. Today's workout was yellow. Today's workout was red. And then it's super glanceable to see those patterns. But that's one of the things that I think it's helpful when you have somebody that understands those parts and pieces, is to make it easy for you to gather that data and then for them to make some sense of it, spit it back at you. And then you get to be kind of an advocate for yourself and saying, you know what, I do see that. That's something we need to look into that a little bit further, and really helps you kind of clarify your recipe, so to speak.
Yeah, I think that's fantastic. It's a big theme that's coming up over and over again, is that individualized approach, right? Where we can't treat this in a cookie cutter fashion. And even within one woman, within her particular journey, it's not going to
be
absolutely stepwise. Like
every kid throws something else at it. and my whole thing, I'm like, ooh, what's the next step? Perimenopause. Yay. Yeah. You will know when my content shifts what's going on in my life.
Exactly right.
It's on my to-do list. We're not there yet. Yeah. But it's on my to-do list.
Oh my goodness. It's so funny because being a woman is amazing, but sometimes these hormonal shifts, it's just like, just when I got this figured out, all of a sudden, bing, something new.
Oh, I know. Well, that's, I had a friend reach out to me. She did this interview with her friend in the car, and I guess they had just come from Soul Cycle, and obviously this was months ago, but all of a sudden, like, I guess she was just coming up off the saddle and all of a sudden having leakage. And there is this whole group of women that they didn't have any postpartum symptoms, but now that they're in perimenopause, menopause, what the hormones do is they actually improve kind of that stiffness and tissue integrity. And so when those hormones deplete, then all of a sudden, I kind of compare it to like an iceberg. Like, you didn't really know what was going on, and now all of a sudden with those hormones depleted, now you kind of see what's underneath, and you probably did have some pelvic floor issues, but it wasn't enough that it was a problem, but now you have to deal with it. But it really freaks women out because they thought they were in the clear. And so, and it's not okay just to, throw your black pants on or your patterned pants and call it a day,
No. Well, and that just also to the point where it's like, now is the time to treat it wherever you are in your postpartum journey. Even if you're not early postpartum, you're later postpartum, and you're thinking, I don't really have any major issues, but sometimes I may feel some heaviness. Sometimes look after it now so that it doesn't become a bigger issue down the road.
That comes up a lot. I have a lot of my joke is that every woman in Northern Virginia who's had a kid thinks that they have diastasis, and most of them don't. But that's kind of like a gateway drug, I'll be honest with you.
Yes.
Because they come in for that, and I'm like, no, you don't have that. But I'll ask them the screening questions. Do you have leakage? Do you have any issues with constipation, pain with sex? Well, yeah, but isn't that normal? I'm like, funny you should say. So lots of times it's the other things that start the conversation, because everybody's worried about diastasis and the aesthetics and all that stuff, but it's these other things like, oh, but I have a little leak when I giggle. I'm like, well, how long have you had that? And then it gets interesting because it's either come up since kids or they've had it since they were a kid, and that tells you, oh wow, there was a whole bunch of things in play way before you had kids, and that may predispose you to some other things later on. So diastasis is definitely the thing that gets them in the door.
That's the thing, right? It's like the hot topic. Yeah.
Yes. Very much so. Very much so.
Yeah. Which, it's good. Whatever's getting you in to see your pelvic floor physio, that's fantastic.
Exactly. I will take whatever that is.
Exactly. Just get them in the door.
Yep.
Well, this is fantastic, Carrie. So I guess kind of a woman that is listening to this, she's realizing maybe she's already been running, she's experiencing symptoms, or she wants to get back into running. What are some of the first steps that she should be taking?
I think, if you have the ability, it's surround yourself with people that know more than you. And that's what I honestly try and do all the time. So much of what I've learned returning to run postpartum has come from kind of what do we need to return to run from injury anyway? And I think that's the thing that people don't realize is this is returning to run from an injury. Why aren't we talking about this? Why aren't we treating this the same as you would like, oh, my IT band or my knee or my ankle? And so I think, especially when people try and treat it themselves, like, oh, I did Kegels and it didn't work, so I guess that's it. Like, actually, it's important, I think, especially with running, to align yourself with people that not only understand running, but understand the pelvic floor component of this. And sometimes you're lucky enough it's in the same person. And sometimes you kind of have to, kind of patch your team together a little bit, to make sure that you've got good core strength, good hip strength. And, it's one of those things too. Again, there's a lot of stuff out there about, you have to run in a precise way and breathe in a precise way. And I think the data looking at returning to run after injury is actually saying the more simple, the better. Like the quieter you run, the better. A quicker turnover and getting that cadence up to like 170 beats per minute is actually better than kind of slow plodding. But unless you're kind of hanging out with those running voices, you wouldn't necessarily know that or be able to put that together. And I think that's the really hard thing about kind of how to go about this is surround yourself with voices that not only understand the return to run after injury, but the return to run postpartum, and not just return to activity postpartum. Running's a whole special animal.
Sure is.
But yeah, I think that's probably the best place to start. And I think to come in with an understanding that, it might mean that you have to do some strengthening. And I think that, if you're a runner, that's, the curse of death there. Oh my gosh, I have to do something other than run.
Yeah.
Because that time is wasted. It should be time running. Yeah. And when you have little kids at home, like you're on the clock.
Oh, yeah.
So my whole thing too is like, if somebody's going to give you 20 things to do, go find somebody else. Like I'm all about where the needs, how little do I have to do to make sure that I get the most of what I need to get out and be injury free, like that, get the most bang for your buck and go. If somebody's throwing, an hour of prep work ahead, no, no, because I don't have time.
No. Yeah.
And frankly, you don't need it. I'll be honest with you. You just don't need it.
No. Yeah. That's amazing. And I really love that kind of the simple and just being mindful about what you particularly need in life to get back into it. Well, thank you so much for doing this, Carrie.
Oh, this is good. I love talking. This is fun stuff. This is what I love talking about. So thanks for having me on.
Absolutely. Thanks. Hey, does your body feel pretty different since becoming a mom and you just wish you could feel stronger and more like yourself again? If this sounds like you, I want you to know that the solution isn't to push yourself harder or work out more. What you need is a whole new way of thinking about your body and the right, proven postpartum fitness strategies. Because you're a mom now, your life and body is suddenly drastically different, and what worked pre-baby is not what will work now. You need a new approach. You need to know how to work out safely after baby. And that happens to be the name of my free program. You can head to jennadalton.com/free, where you can snag 3 15-minute home workouts so you can regain your strength in 2 key areas moms need to focus on the most. And you'll also learn the #1 secret you need to know about postpartum fitness that you probably haven't heard from anyone else, even your doctor. Head to jennadalton.com/free to get it.